Welcome, everyone. I am Bob Aksafa, and on behalf of myself and my partners at the Buncke Clinic, Dr. Greg Buncke, Rudy Buntick, Andrew Watt, and Walter Lin, I'd like to welcome you all to the Buncke Clinic Virtual Visiting Professor Series. Tonight we have the honor to introduce and host virtually a true icon in the field of hand surgery, plastic surgery, and orthopedic surgery, Professor Scott Levin from the University of Pennsylvania. Dr. Levin, as we all know, is chair of the Department of Orthopedic Surgery and the Paul Magnuson Professor of Bone and Joint Surgery, as well as Professor of Plastic Surgery at the University of Pennsylvania in Philadelphia. There are many, many things that we can talk about with Dr. Levin, but I've just summarized just a few of his accomplishments. He is currently the Vice Chair of the Board of Regents of the American College of Surgeons. He is the immediate past president of the American Society for Surgery of the Hand. He is a past president of ASRM, past president of WSRM. He is past president of ASRT, the Transplantation Society. He is the Godina Fellow from 1997 through ASRM. And for those who were with us last week, we hosted Dr. Jim Higgins. And when I was introducing him, I mentioned that there are 3 surgeons in the history of ASRM and ASSH who have won both the Godina Fellowship and the Bunnell Fellowship. And one of them obviously is Dr. Jim Higgins, and I mentioned that the other 2 will be giving us talks in the next few weeks as well. Dr. Levin is one of the other 3 of the other 2 surgeons, and he was the ASSH Bunnell Fellow in 1999. I'm going to ask everyone who's not speaking to please turn your microphones off. Thank you so much. Let's see who that is. We'll try to turn this person on here, or off rather. Okay, good, perfect. Continuing. As we know, Dr. Levin created the Duke Flap course when he was at Duke before he moved to Penn over 10 years ago. And he also created the Penn Flap course. And these both show Dr. Levin's commitment to education, as he has helped train likely over 1,000 folks just through the flap courses at Duke and at Penn. He established the National Hand Trauma Network, which was recognized by both the ACS and the ASSH. And he also helped create the field of orthoplastic surgery. On a personal level, I've had the pleasure of not only getting to know Dr. Levin, but also visit him in person as well. Those of you who were on a few weeks ago, we hosted both Professor Sabapathy and Professor Venkatramani from Ganga Hospital. When I was there visiting them, I actually noticed that in the library, there's an entire Scott Levin section of their library. And it says here, as a proponent of orthoplastic surgery and past president of WSRM. And this was fortuitous because it was literally a few days before I was flying to Philadelphia to actually visit Dr. Levin and spend a few days with him for the Penn Flap course, as well as in the operating room as well. And his office really is a shrine to the greats of microsurgery, hand surgery, plastic and orthopedic surgery. And so it's truly almost a museum of sorts. And so it's really fun to see that. And this is actually a photograph of him operating with Professor Fu Chan Wei, I believe, who gave us a talk. Oh, it's Bill Shaw. I'm sorry. Oh, I'm sorry. There was another picture. That's right. Yeah, that's right. It was the other one. And Professor Wei, as you know, gave us a talk last week as well. This is the Dr. Levin at the Penn Flap course. And this was, again, another fantastic experience I had last year with him. And we had the privilege of hosting Dr. Levin. This is a textbook that he's written with Professor German, who also gave us a talk a couple of weeks ago, and Randy Sherman. And Dr. Levin, when he was in San Francisco for ACS, was kind enough to stop by and educate us on transplantation. We had a phenomenal time with him and his wife, Helga, as well. And Scott, thank you so much again for joining us. It's an honor to have you, and I know it's late on the East Coast, and so we really appreciate you taking the time out of your very busy schedule.
Sure.
What I'm going to do is I'm going to make you a presenter now, and you should be able to share your screen. So in just a second, you'll see that prompt, and you'll be able to share your desktop with us.
Should I hit share here?
Yeah, go ahead and hit share, and then you can share the.
There we are.
Then go presentation mode.
Okay, so do you see my, oops, what happened to me, buddy?
I don't see it yet. There you go. Okay, perfect.
Let me go back to this. Okay, good. So, Bob, thank you for that kind introduction. I have so many friends on, and it's absolutely wonderful to link with the entire world. Balakrishnan and Other friends from India are on, but my professor, J. Leonard Gollner, who was president of the Hand Society, said, you know, it takes one to talk and one to listen. And so I think, like the incredible teaching at the Buncke Clinic, the incredible faculty at UCSF Plastic Surgery, I'm just one of many who likes to give back. The adage, we stand on the shoulders of giants. There's no larger giant than Harry Buncke, who I knew and revered, because not so much of his contributions and his pioneering efforts winning the Julius Jacobson Award, but the kind of person he was. Unparalleled humility, caring for others, not afraid to say to people, I don't know the answer to that question, not afraid to say, I made a mistake, not afraid to say, I don't know where I am in the dissection of this flap. Maybe Harry never said that, but not infrequently in my early days, I would say, let's stop here for a second. I'm not quite sure where we are, and get my bearings, and then we continue for a successful free tissue transfer. So I was a visiting professor during College of Surgeons last October, as Bob talked to you. And as I received the honor of giving this lecture tonight, and I said, I'm going to talk about the evolution of orthoplastic surgery. I said, wait a second. That's what I spoke about last October. So the fellows will either not tune in, or they'll fall asleep, or maybe not tune in and fall asleep. So I changed things up at the last second and want to reflect on a talk that I gave at the micro meeting last year. And it's really, I think, a passion of mine. You heard that Bob said I set up the flap courses this year, by the way, for the residents and the fellows. The flap course will be virtual, but more important, Dr. Balakrishnan, we're going to disseminate and broadcast the flap course all over the world free of charge. So all the 40 or 50 flaps that we dissect will be some live, some pre-recorded, but we're going to do that because it's the right thing to do in the era of the pandemic. And the more we share, the more others learn. So let me get into the meat of this talk. For those of you who heard a rendition of it, my apologies, but I think you can always, one can always learn and benefit from repeat information. These are my disclosures from the Hans-Jörg Wyss Foundation and the DoD for research funding related to VCA. So the history of anatomy, I think, can sort of be divided into ancient history and then modern history. And the names on the left, you know, Gray's Anatomy, and I'm not talking about the Hollywood production, but the big Gray's Anatomy that sits up on my shelf, Leonardo da Vinci, Michelangelo, Galen, Vesalius, John and William Hunter. These were the real pioneers in anatomy. And why was anatomy studied? To understand the human body, to understand disease, to understand medicine. And then we jump ahead a few centuries to Manchot from Germany, Salmon from France, who did some of the first work on perforasomes or angiosomes, depending on which term you like to use, the St. Cyr term or the G. Ian Taylor term from down under in Australia. I'm an aficionado of Ian's work and have great respect for Mike St. Cyr. In your community, the late Steve Mathis was an icon in reconstructive surgery, along with Fouad Nahai from Atlanta. Dr. Nahai lives in Atlanta. Fouad and Steve Mathis, under the encouragement of Yashir Kewitz at Emory, developed the book on muscle and musculocutaneous flaps, flaps in an array of anatomic discovery that we rarely use anymore, with the exception of, let's say, a functional gracilis. Do I still use muscle flaps? Yes, there's a place for the latissimus. There has been, there is, and there always will be, in my opinion. And then again, I mentioned Ian Taylor earlier, who's contributed to the understanding of anatomy, but more importantly, as it relates to reconstructive microsurgery. The French school, which for a long time remained somewhat hidden. Dr. Safa and Hansen and others who are hand surgeons know the work of Raoul Tubiana from Paris, who is a consummate anatomist. We go to Argentina, Eduardo Zancoli, an incredible surgeon, hand surgeon, yet wrote books on anatomy that have not yet to be translated from Spanish. And then my anatomic modern hero, my crusader, Robert Acklin. We use the Acklin clamp. You've heard of the Acklin Atlas, but Bob, in the latter 25 years of his career, devoted his life to studying anatomy, and that's where I sort of first got the bug. Dr. Acklin passed away several years ago from pancreatic cancer, but his contributions to our field in terms of microsurgery instruments, the use of the operating microscope, understanding thrombosis, the lateral arm flap, I could go on and on, were many of his contributions. I think any of you, one of the things that's really important, Dr. Safa mentioned his Gardena traveling fellowship, which took him around the world. There are people on the phone, or actually on the video now, who have traveled. Let me share with the residents and even the students and the fellows who are finishing. You must travel. If you do nothing to enhance your post-fellowship training, commit at least a week, a year, and go visit somebody. Have an interest, go see what others do, how they do it, share the trials and tribulations. And I have had the good privilege, with having so many friends around the world in reconstructive surgery, to go and visit, to learn. And this is in Firenze, in Florence. And Marco Innocenti is one of my closest friends, an incredible microsurgeon who's done incredible work in tumor reconstructive surgery and vascularized epiphyseal transfer. And visiting him, he allowed me to visit La Specula, 1775, sponsored by the Medici family. Look at, these are wax figures. Look at the intricate detail. Eddie Rodriguez would be drooling. Laurent Lantieri would be drooling over the facial vasculature done in wax casting in the 18th century. And this is a sight to be seen. These were produced at that time, and it's an incredible museum in Florence, and I recommend it to you. Parenthetically, yes, you may know how to do a deep or a tram or a free latissimus, but I marvel and remain impassioned about being able to go to the cadaver lab and dissect. And I'll get to that in a minute. But while I've encouraged you to take a week out of your practice, and now I said, well, it's part of your practice in the first, well, I'm at this 30 years and I still go to the lab. Try to go and dissect. I can ask Dr. Hansen or Dr. Poe or Dr. Safa, but nothing substitutes for continued anatomic learning, practice, and dissection. And you have to have a passion for it. I mean, look at this guy's arm. I mean, just incredible. The flexor system, the palmar arch, the distal vessels, all this done in wax. And there's a great book that I'd recommend to you. A lot's been written about the history of anatomy, and The Knife Man is about John and William Hunter. Those of you who get over to Great Britain, to London, try to visit the Hunterian Museum. But before you had your medical school cadaver lab, parenthetically, a medical school experience that tragically may go away. As a matter of fact, this year at Penn, I'm helping the medical students do virtual anatomy. We're going to do pro sections on fresh cadaveric material and broadcast it to the students, the incoming freshman students. We don't have a choice. Well, we do, but we don't. And you must understand, or I remain firmly committed, that the laying of hands on, as it's called, that you did in medical school when you had your cadaver, him or her, I think is a rite of passage. And it's a rite of passage as a healing physician, as a surgeon particularly, that we should never, ever lose. I don't care about heads-up display. I don't care about virtual reality. I don't care about avatars. Picking up a knife, opening the skin, finding the vessels, nerves, tendons, and structures is a time-honored procedure that I hope never goes away. But the Knife Man was about John and William Hunter, and of course, everybody I hope has heard of the concept of body snatching. The only way people could get anatomic parts for medical research, there was no anatomic gifts program in the medical schools. There was no state human gift registry. You know, Hunter wanted to get a body to dissect and look at the adductor canal and understand the popliteal aneurysm. He'd give you know, a guy that worked in the graveyard, you know, a few quid, as they said back then. And after the family went away, and a day or two later, they dig up the coffin and steal the corpse. So this talks about that, but it really was the beginning of modern surgery. And again, look, we're about 225 years or so, 200 to 250 years. University of Pennsylvania Hospital is 250 years old, started by Benjamin Rush and Ben Franklin. And only 250 years ago, we were in the desert in terms of our knowledge of anatomy. Another great book by Lindsay Fitzharris, New York Times bestseller, is about Joseph Lister, The Butchering Art. And probably in your training, and not so much now with TMR, osseointegrated implants, the work being done on RPNI by, you just had Paul Soderna lecture you, no doubt, on treatment of neuroma and RPNI. If you survived your amputation, which was the treatment for all sorts of maladies of the extremity, and you didn't get infected and you didn't die, the fate of the amputee, living or dying, was based on the strength of the surgeon, the sharpness of the knife, and the person who literally was the holder of the patient, and those that came and actually put pressure on the blood vessels. So that's the rudimentary operation of its day. And Samuel Gross is a great Philadelphia surgeon, portrayed by the painter Thomas Eakins. And Babak, I don't know if you could see me or saw me before I started my talk, but behind me is this painting reproduced by a friend of my dad's, and it's in my study. But Lister, of course, for a long time was an outcast until he understood the germ theory and came up with antisepsis. And I don't mean Listerine mouthwash, but he was the great surgeon of his time who persisted until he understood perioperative sepsis and made other hallmark discoveries that allows us to do what we're doing now. The fate of medical students at that time, here's Thomas Percival, as in Percival Potts disease, Edinburgh. He lived to the ripe age of 64, which was pretty old in those days. And the first thing that he would tell the senior medical students to the incoming freshman medical students. Do not incite terror. Stay calm. Do not incite terror. So you're probably sitting there thinking, what is Levin talking about? Inciting terror was the fate of many medical students who would die if they were cut by a knife, if they nicked their skin. Mind you, hello, no N95 masks, no gloves, no gowns, nothing. Dissection was done with the bare hands, barely a place to wash, no antisepsis, no cleanliness. And so if you were dissecting and a bone shard cut you, chances are you would get an infection, and a high percentage of students died from infection. And then, the closing remarks before they headed to the anatomy lab in London at St. Bart's. God help you all. What will become of you? Meaning, good luck. Hope you get through anatomy and survive. Bigelow ligament at Harvard, formerly at Penn. This is Pennsylvania Hospital, the oldest hospital in the United States, where I still operate. This is the amphitheater. And again, dissections were done at that time. William Gardner likened the study of anatomy and would warn and admonish the medical students in Scotland and Glasgow, sort of beware of the grim reaper. This guy right here, that going into the anatomy lab was no guarantee that you'd come out. And most people know Hector Berlioz from his composing, the French composer. But believe it or not, and I tried to get these pictures of what the cadaver labs looked like in that day. And of course, Paris, I'm embarrassed to say, I love Paris, but there was no garbage collection, absolute squalor, poverty. And this is what the streets of Paris look like, with filth, waste, sewage in the streets. And let me quote to you what Berlioz said and why he became a famous composer and conductor and not a medical student. At the site of that terrible charnel house, the fragments of limbs, the grinning heads and gaping skulls, the bloody quagmire underfoot, and the atrocious smell it gave off, the swarms of sparrows wrangling over scraps of lung, the rats in the corners gnawing at the bleeding vertebra. Such a feeling of revulsion possessed me that I leapt through the window of the dissecting room and fled for home as though death and all his hideous train were at my heels. So that's a famous quote from Berlioz, and of course, Dr. South is a consummate musician, so he can tell you about Berlioz. But let's just say he didn't survive as a medical student, and that's a true quote for him. Little ventilation, and particularly in the winter. Can you imagine a fire at one end of the room and all of these decaying cadavers and so forth? I guess it's about 5:15, and those of you who are going to have dim sum or dinner, I apologize, but I've already eaten. Burke and Hare were two very famous grave robbers, ultimately convicted, but were responsible for literally hundreds of corpses that they presented to the anatomist in the medical school at that time, and they were both hung for their crimes of body snatching. We move past Scotland and Europe in the 18th century and move into Karl Mangeot, who was one of the first anatomists and surgeons from Germany to sort of define the cutaneous circulation of the skin. And this is sort of a reproduction from his book. No, this is not the ALT perforator of Dr. Buncke last week, or Dr. Safa. This was the concept from his book on how tissues could be moved around and the arborization, and the old adage that I use when I'm doing my perforator flap: all roads lead to Rome. What, right? You find a little tiny, tiny perforating vessel, and if you trace that through the vastus or the rectus, you ultimately come to the source artery, and that was his principle. The fellow on the right here actually lives in my building. He was an MD PhD who did his PhD work on the history of anatomy. His name is Russ Mollitz. He's a good friend of mine, and he wrote a book called Morbid Appearances, The Anatomy of Pathology in the Early 19th Century. And listen to what he says.
Scott, is your computer on mute by any chance?
No.
We can't hear it. I wonder if the volume is up on your computer.
It is.
Okay. Can you hear it over there?
I can.
Oh, for some reason it's not playing on this. I'm not sure why. Well, apologies for that.
Can't hear it, huh?
We can't hear it. No, sorry about that.
Okay, let me move on then. And then another great book on cadavers is written by Mary Roach, again a New York Times bestseller. What they're used for, obviously study of ballistics at the Surgical Research Institute and so forth. So now we're getting sort of to the modern era of anatomic dissection and anatomy continuing for a purpose, and I'll talk a little bit more about that when I talk about the evolution of microsurgery. So these are some also early anatomists. Again, the only operation that existed at the time of Paret, Dupuytren, was amputation. And one of the people that had tremendous influence on me was J. William Littler. And Littler was a Duke medical student, obviously president of the Hand Society. He did his plastic surgery training at Columbia with Jerome Webster, was working with Joe Murray and actually Robert Chase, who's not too far from you, at Valley Forge. And Littler was an incredible anatomist. These are neuroscience drawings that he did while he was a Duke undergrad before he went to medical school. And here he is in the roster of the medical school. And I knew Dr. Littler, and he presented this this cartoon to me. Of course, the person who wrote Frankenstein was Mary Wollstonecraft Shelley. And so this is what he titled this cartoon. And if you look, Baba, can you see my pointer moving around?
Yes, we can see the pointer well.
So this is 122 years ago. George Monks introduced the concept of a pedicle and tissue. The dominant plastic, Nicoledani, of course, from Vienna. Carrel, the father of vascular surgery. Everybody should know who Carrel is, winning the Nobel Prize, but also dying in disgrace as a Nazi sympathizer. The Huber transfer for the congenital thumb defect was another concept to create opposition. Shaw and Payne, SGNO, 1946. They were real pioneers in early flap surgery for hand surgery. Darrell Shaw, during World War II, introduced the idea of a sort of a skin flap for coverage of the burn. Hilgenfeldt was a German collaborator with Littler, who was also interested in policization. And then look here. We get to 1960, and this is when Julius Jacobson introduced the operating microscope, and the rest is sort of microsurgical history. And this is Bill Littler. I know it's Littler, but he might have just had this photo taken when he was looking under the scope in New York at Roosevelt Hospital. He never did microsurgery. Of interest, the orthopedic mentor of mine, Len Dolner, discussed Littler's paper, The Neurovascular Pedicle Transfer of Tissue in Reconstructive Hand Surgery. And Littler was, class of 42 at Duke Medical School. Goldner came sometime later, and this might have been at a Duke reunion. At any rate, the history goes on. As I said, I had the occasion to meet Dr. Littler, and he was kind enough to redraw his classic 1955 heterodigital island flap. Again, one of the earlier versions of the book that I did with Randy Sherman and Gunter German was the hand clinics here, where this was portrayed. So the idea of moving tissue as a pedicle flap goes way back, probably 70 years. And again, the heterodigital island flap, which we don't use because we have things like wraparounds and toe poke transfers and web space transfers and other boutique microsurgical bits and parts from the foot that Harry Buncke popularized, and Greg and Andrew and Bobak and Rudy are so adept at. It's rare that we would consider robbing Peter to pay Paul, meaning a heterodigital island flap where we can take a fibular sided based free toe poke flap for the same thing. But I love surgical history. Now we're getting into modern history. And look at this. This is 1978. 1978, and Littler attended the Norfolk flap course. Okay, let me just stop right here. And please don't let me bore you, but please indulge me that you really ought to know who these people are. Jerry Adamson, Rob Acklin, the late John Bostwick from Atlanta, Bakamjian from New York at Strong Memorial, Harry Buncke, faculty, Caraway, the eyeball man, Daniel did the first free flap as a fellow, and Ian Taylor, Avron Damiel, Dave DeBell, Elof Erickson, Willie Furlow, Bill Futrell, Charlie Horton, deceased, Josh Yurkewitz, Tom Krizik, Louis Vasquez, Daryl Shaw here, Don Serafin from Duke, Bernie O'Brien. The list goes on. Ian McGregor from Canisburn, John McGraw, still living, Joe McCarthy, Jim May from Harvard, Stevie Mathis, McGee, Operation Smile, Dr. Littler, Graham Lister, Harvey Zarum. And over time, of course, we've lost many of these greats, but what did they do? They gathered to do what? They gathered to do dissection. All accomplished surgeons. And I'll tell you, when you do these courses, as a participant, you learn, but as a teacher, you learn more. And of course, I mentioned Littler's cartoon in 1960. This is Julius Jacobson, who's a vascular surgeon from Vermont, then relocated to New York City at Mount Sinai. Qinshan Wei, the first replant surgeon in China, revered there. And Harold Kleinert, my mentor. And here's Bob Acklin. And this is the tissue lab at Penn where we do our dissections. You know Bob from the Acklin clamp. And he was instrumental in honoring S&T. Werner Springler is and Gene Tritt. Tritt has deceased. This is Victor Meyer from Zurich, Switzerland at the International Microsurgery Society. That society doesn't exist anymore. It was replaced by the WSRM. But S&T are the Springler and Tritt who started the S&T Instrument Company, and all the research on the instrument tips and microsutures and scope and thrombosis was done by Bob Acklin. So for the Buncke micro fellows, this gives you a little sense of history that I think is really important. And if you want to see the most gorgeous dissections, look at Bob Acklin's video atlas of anatomy. He did all these dissections himself, painstaking photographs, lighting, positioning of the cadavers to just get it just right. So here's the deltoid about 10 weeks ago, 10 days ago on a wounded warrior. We did a free scapular flap. Dr. Safik, are you listening? You remember that term, scapular free flap? There are other cutaneous flaps, sir, other than the ALT.
Absolutely.
And Larry Gottlieb talks about going back to the back. And I hope that the fellows have an opportunity to find the triangular space and know where the quadrilateral space is. We just did a triceps to axillary nerve transfer. So, folks, if you think I love anatomy, you're right. And here's Bob Eklund. And again, the thing, let me just stop for a second. It's a little emotional for me tonight, sitting in my study talking to you. I don't know who's sitting there, but that's Bob. And that Bob came to the Duke Flap course when Yixing Zhang, now one of the not rising star, one of the international stars on microsurgery from the Nine People's Hospital. Yixing was my fellow, and this is 2006. So this is almost 14 years ago, and we honored Bob at that time, and he was just as enthusiastic in 2006 as he was when I was with him in 1991. And now Zhang has gone on to take his place as one of the leaders among many in perforator flap application, particularly for head and neck and burn scar. So just remember to give back. Remember that there are those that come before you that are willing to impart their knowledge. And that's why I think this sort of virtual education around the world and formats like this are going to become more and more important, because we can reach more people. You know, it was a big deal for Zhang to leave his family, his wife behind, come to Duke for a year, but he got to meet Bob Eklund. Just think if he could do a Zoom chat with Bob, or the equivalent of Bob today. A little more history here. Sussuma Tamai, the first replant. And then, of course, our beloved Harry Buncke, who more than a half a century ago did work and presented at the Plastic Surgery Research Council on toe-to-hand transfer. Bottom right is one of my cases. And he won the Jacobson Award. Dr. Buncke was given the Jacobson Award by Julius Jacobson, one of the early award winners for his work in reconstructive microsurgery. And there's Greg looking across from his dad. So I want to just stop again and recognize Harry for what he meant to me. But this whole movement, you all wouldn't be sitting there today if it wasn't for the grit, the persistence, the genius, the humility of Harry Buncke. Here is Steve Mathis. Again, I talked about him before. And again, as the torch has been passed, my partner and dear friend Mike Zen, along with Glenn Jones, took the Mathis Nahai Atlas from the 80s, 79 actually, and reproduced this with a much broader array based on angiosomes and perforator flaps and all the things that are evolved beyond the step 5 types of classification. And this is me operating with FOAD in 1988. That's Lenny Furlow and Josh Yurkiewicz here, and of course, Steve Mathis. So there are 3 microsurgical ears. The ear of replantation, that's all we could do. Thanks to Professor Sapa and the Buncke Clinic, but really Babak has rekindled and re-energized at least many in North America, certainly all the fellows, for his commitment to a world-class approach to replantation as one of the pillars of microsurgery, and has taken replantation to a whole new level, only mimicked in certain places in the Far East like Korea and in mainland China. And of course, 73 to 98 is the flap evolution over the course of about 25 years. In the last 22 years has been the era of vascularized allotransplant. And this is the microsurgical ladder. I presented this, I think, last October. I'm not going to re-emphasize it, other than these areas would not be here. These developed areas, functional muscle transplant, autologous transfer, freestyle, perforator, lymphatic surgery, have so much to learn, super microsurgery. They wouldn't be here if we didn't understand and continue to study anatomy. That's the take-home message. And you know, this has been sort of a passion of mine now for 30 years. I started with Jim Urbanek and Richard Goldner, Leonard Goldner's son. Jim Urbanek is an attending actually early 1990. Here we are, we were the replant team. And then I'll share with you how I sort of developed the labs, which is an interesting story. I came back from Louisville in 1988. and became chief of plastic surgery in 1995. And we had a new chair of surgery that replaced Dave Saveston. And with the help of the chancellor, Ralph Snyderman, who used to work in your neighborhood, he was the CEO of Genentech before he was recruited back to Duke. I said, I've just been to Louisville. I can go get it was an embalmed cadaver at that time, but I can get a cadaver anytime I want, dissect. And if I'm going to do a head and neck case or a flap or anything the next day with Bob Acklin, I can go to his lab the night before and actually take out a cadaver and practice the operation. And I started with basically one room in the Bell Research Building, then expanded to a larger room. This is what we looked like 23 years ago. And I hired this man, Clint Lewicki. And some of you who've been to the Duke course years ago, any of you may have met Clint. The day after he retired, about 2 years ago, he passed away from a heart attack. The morning after his celebration, and I was asked to give the Lewicki lecture at the Duke Flap course by Scott Hollenbeck a couple years ago, the inaugural lecture. But Clint and our anatomy lab made it into Time magazine, and this was an expose done in Time. No, that's not me with my Zeiss loops on, but here's the article. Clint Lewicki, they're talking about Manish Shah is trying to figure out why Thelma Shue's nose keeps bleeding, blah, blah, blah. And it tells about the study of anatomy. And Clint Lewicki provides body parts for surgical residents. Here he is in the lab, and I'll never forget him. He worked for me for 20 years and was our deaner. And unlike Berlioz, who ran out of the cadaver lab, now we have people that are lab managers, like I have Lori Kish now at Penn, and they do nothing but keep the lab clean, organized, order parts, make sure that the body parts and the cadavers are ethically taken care of, universal precautions. And I just want to give a shout out to Clint, who's probably looking down. This is a long time ago in my career, but was totally dedicated to education in this lab. And a lot has been written about him. He actually worked at Kmart in the butcher department as a meat packer. And my PA found him and we hired him, and the rest is history. And we did the first flap course at USC with Randy Sherman. We flew out there because, interestingly, Steve Mathis said, you can't have a cadaver course because ASPS, he was the ASPS, or excuse me, he was the PSEF educational chair. Then he says, we're giving a course on cosmetic coating, and your cadaver course for flaps will probably interfere with that, so we're not going to endorse it. Okay, I won't say any more, but at the next thing we know, we were able to do an ASPS course at USC. Here's that time. And then our first Duke flap course, and that was before I became chief of plastic surgery in 2005. This is our first Duke flap course in limited scale. And then it's grown over time. And this is what the lab looks like then. The specimens popularized by Clint. They're lightly embalmed, so they're very lifelike. They can be latex injected. And it's not like doing the shriveled up, desiccated cadavers probably most of us had in medical school. It can last for a long time. And here was our conference room then. And that's when Detlev Erdman started with me. And we did some work then on the infragluteal perforator flap with some of his colleagues from Germany. And that was published. So there's always work to be done in the lab. So anatomy, there's applied anatomy, there's your basic dissection, there's research in anatomy. There's still things to be discovered anatomically all over the body, and certainly education is important. There are a lot of changes in the ACGME guidelines. You all know that, having completed your residencies. The new accreditation system is looking at how teaching is occurring. And I'd ask you, what's the question or the opportunity, what's the role or the opportunity of a cadaver lab? And I think it's of paramount importance, particularly as we go to maintenance of certification and competency-based curriculum. We're going to have to be able to go and use tissue demonstrating their competency. You are surgeons, but you're also anatomists. You have less anatomy in medical school. Variable emphasis on surgical anatomy in training programs. Where do you want to make a mistake? Do you want to cut the marginal mandibular nerve practicing your approach to put in a functional gracilis for smile? Or for those of you who peel off and do aesthetic surgery when you're doing your facelift, you ought to know where that marginal mandibular nerve is, or you're getting the facial vessels out for a head and neck case. You don't want to ding that marginal mandibular. So you need to know your anatomy, quality and safety, demonstrate competency, all these things. It used to be C1, B1, teach one. I guess that can hold today in education. But my adage is dissect many, do many, as in do many free flaps, then teach it. Nothing is more embarrassing, and I've seen it, not at my flap course, I won't say any more, to have somebody show up that shows slides out of a book talking about a flap when it's clear they've never, ever done the flap. To me, that's a compromise of education. Those of you have read Malcolm Gladwell's books know that he talks about 10,000 hours makes an expert, 10,000 hours under the microscope. And I tell you that, at least I believe this, that you can always get better, you can always improve, and your skills are acquired and you have to maintain them. There's muscle memory when people talk about a golf swing or tennis swing. I'm so impassioned about microsurgery, I get to do it all the time. I'm teaching dissection. Often I have to do flaps, and sometimes I'll do a flap, most of a dissection, because I want my hands to be working. For example, those of you who are going to go out and be teachers in academic medicine or other arenas, the day you show up as a new attending, don't give all your cases away to a resident. That would be awfully generous of you. And I'm not saying it because you're selfish, but you have not acquired yourself enough knowledge and experience to be a good teacher, and you also want to get your skill level up. And it's not, you won't compromise the education of residents, you'll compromise yourself if you don't do it right for a long period of time. And you want to get to the point where if somebody breaks something, they cut a pedicle, whatever it is, they do a poor dissection, you can get back up on your feet, either fix the pedicle or do a different flap and fix it. So core competency is micro skills, of course. And then I just want to reflect on my mentors, people that have meant so much to me. They're my anatomic heroes. Reinhold Gonz is probably the foremost hip surgeon in the world from Bern, Switzerland. At the age of 62, took a sabbatical after doing thousands and thousands and thousands of pelvic fractures, hip fractures, femoral osteotomies, went and dissected in Paris for 6 months to learn more about the blood supply to the femoral head, and learned how to do surgical dislocation that he's given to the world. Fuchan Wei, a household name. This is me with Fuchan as a fellow at Sun Yat-sen Cancer Center. I was at Changmyung, 1991, the consummate anatomist. The osteocutaneous fibula with Yoshimura and Moro Beppu, my friend, who you saw with Tamai, they did the skin paddle anatomy. Ian Taylor on the right, Bill Littler, Acklin I've talked about, and Jim Urbanek, my orthopedic mentor, one of the first founding fathers of the ASRM, said if you know your anatomy, you know surgery, and you can be a good surgeon. We've talked about these anatomic terms. I won't belabor that. And here I am with Ian, who spent about a week with us, and just an absolute delight. Remember, I told you, you got to go and you got to travel, and you got to visit people and have people come visit you. That's how you learn. And here's his pioneering work on the vascularized epiphyseal transfer. We're just putting together our combined series with Detlev Erdmann and Marco Innocenti, Steve Kovac, and myself of our experience with this. But how did Ian Taylor give children with sarcoma and other maladies a chance to keep their extremity anatomy? And there's the G. Ian Taylor Society that he started. This is him dissecting with us. And let's see if I can get this down.
Yeah, I'm really
Uh,
sorry. I'm not sure
okay,
why the
all
audio
right,
is not
we'll
playing.
just skip them. But Ian made a comment about not only anatomy but VCA, and it's a new opportunity for anatomic dissection and anatomic learning. Here are the applications for the tissue lab, operating room environment for team training, workshops for products, you know that, simulation for endoscopy, robotics. We were in the cadaver lab last night with an ex vivo perfusion machine we're trying to develop here with an arm that we procured from the Gift of Life Organ Procurement Agency. Kovac and I and the fellows were down there just last night. So I'm still at it at 65 going on 66, and it's just a true joy in my life as a surgeon to continue to embrace anatomy. Other applications, you can read this and see it for yourself, but it's been very instrumental in our hand transplant program. And we've had courses in our lab. There's Jamie Levin from NYU. There's Steve Kovac. I think that's Peter Nelligan in the back. But we love having these courses. And again, we learn a lot more than we teach. Again, here's our cadaver dissections for our hand transplant program. And the opponents here that come back in this patient, see, about a year and a half after her bilateral arm transplants. I think I showed that the last time I was out in San Francisco at Buncke. So for the fellows and residents and students, practice makes perfect. 80-hour week is a bummer. We could debate that for hours, but your time in training should be extended, not curtailed. And the way you make up for it is get into that cadaver lab. We've been able to innovate with anatomic studies. This is our sternal plate. I had royalties before, I don't have any now, but by way of disclosure, I have to share that with you. They're made by KLS Martin for sternal instability, and all of the prototypes were applied in the cadaver lab, and the measurements and the things were worked out studying anatomy, not in the days of Vesalius or Galen, but in sort of 1993, 94, and 95. We've had a lot of courses. I've been around all over the world. We've had now probably 20, going on 20 years of doing this. And I've dissected all over the world in these formats, and it's just an absolute joy. Our first Duke course, here's Gunter Gurman, Milan Stevanovic, Chris Peterson, Mike Zen, Joe Upton, and Joe Cerletti. A couple others here. Here's Mike and I, and Jesse Silber, and Siderna was just with you, and let's see, I think that's Nelligan up there, and Hollenbeck, and Larry Colin, and so we have a big time. Sherman's been there forever, but these are the people that have really dedicated to this anatomic teaching. Elaine is a good friend of mine, and again has done a lot to contribute. This is Singapore. I dissected, and we were doing the medial femoral condyle flap on a cadaver, and somebody somehow just blinked the light, and I saw this picture, and this reminded me of Mancho's slide that I showed you a little while ago. And I look at that, and if it weren't for my wife objecting, I'd blow this up to like a 4 by 6 foot poster and frame it and put it in my living room, but probably wouldn't work at home too well. But isn't that gorgeous? This is the medial geniculate system off the SFA and the arborization on the periosteum, and that's in a cadaver. I mean, that to me is art. It's also science. I want to give credit to Philippe Blondel and Asao Koshima and many others, Axel Feller. A lot of people around there. Is Bobby Allen here started. There's Bill Shaw, the late Bill Shaw, the perforator courses. This was in Ghent, Belgium, the first course 23 years ago, and they continue to take place. And of course, we have books written, Jeffrey Hollick, but this is where I am. That's my buddy, Ben Franklin. And this is our lab here. Cost $2.5 million to build it. Some of you have met Lori Kish, who've been at our flap course, sort of dovetailing on the Duke lab, only better, I would say. And we have joint replacement courses, CME, rehearsal for all sorts of things, and have an oversight committee. And this is the the Duke lab when I left, and this is the Penn lab now. So similar concepts, and we have all sorts of courses that we put on. Here's Heinz Berger, Jimmy Higgins, Jeffrey Halleck, Milan, Alan Bishop, just a great group of people. All have contributed to the anatomy of reconstructive microsurgery in their own way, and we're still at it. Cadaver workshop, it's hard to believe it's been 8 years, but we had people from all over the world do face and arm transplants, new anatomy for the highest rung on the reconstructive ladder, and very, very enchanting to do this. Here's Adam Jurkiewicz from Poland with Laurent Lanteri. So again, there's sort of a we are the world, like Stevie Wonder used to sing. There's a global passion for this, and when we can come together and you can insert yourself either for a day or a week with somebody and go to the anatomy lab, that's a special thing. And so I love this quote from John F. Kennedy in his inaugural address in his Boston accent. The torch has been passed to a new generation. And if I leave you with one thing tonight, it's that you are the new generation. You sitting in San Francisco at Ralph K. Davies with Dr. Salfa need to be the next generation of people that will be mentioned as those that drive the specialty forward by new ideas in anatomy, new applications of flaps, further development of VCA, the whole anatomy of lymphatic microsurgery, super microsurgery, finer and finer instruments, optics. You are the new generation. And so you now, as you get prepared to finish in July or August, cannot be the passive learner. You have to be the active innovator. Certainly taking what you've done, and as I said, practice makes perfect, but there are several of you sitting in the room that I hope will be the next generation, the new generation. And when you look back 30 years from now, that's how long I've been in practice. And I was an orderly in the emergency room in 1974, so I saw Jim Urbanek doing replantation. That's when I became interested in reconstructive microsurgery. And what did I tell you? In 1974 or 73, that was the only thing that was popular in microsurgery was replants. The replants you've done in your fellowship, thanks to Safa and all the faculty there. And again, it wasn't until 73, 74 that Ian did the first free flap, but that's when I first saw microsurgery and was bitten by the bug. William Osler, the great scholar from Canada, chair of medicine at Penn before he went to Hopkins. Medicine is learned by the bedside and not in the classroom. Let not your conceptions of disease come from words heard in the lecture room or read from the book. So I'm sorry about the lecture tonight. See and then reason and compare and control, but see first. So I think this applies to your study of anatomy as good microsurgeons and reconstructive surgeons. You have to see it. And Bob Acklin used to say, if you can see it, you can do it. There now, you try. And Bob was referring to magnification as it related to doing a microsurgical anastomosis. But bless his soul, I will expand that. If you can see it, you can do it. If you know where the pedicle is, you know your anatomy, you can do it. And Clint Lewicki helped us see by all the work he did. And, you know, I had great opportunity to, as Babak said, I think we're probably up to about 1,000 learners, 300 hours. The impact, though, is priceless, hopefully on the people we taught and the things that they learn that they can later transmit to the most important people, our patients. So unfortunately, this has the Beatles song, I Get By With a Little Help From My Friends. But this is just a vignette some of you might have seen, and that's Muscale and our flap group, Shibata from Japan. There's Glenn Jones, Steve, Randy Sherman. Who else do you saw this before, I think, Sedurna. Different people. There's Mingwei Chen from Taiwan. Manny Melisinos, one of my heroes. Mikey Miller. Colin again, have fun. German, my brother-in-law. And Jim Higgins, Gadina Fellow. There's Manny. And Raja Sabavathy and Giorgio De Santis from Italy. Peterson again. Kovac. And you see how the instructors are looking over each other's shoulders. We always can learn. Steve Hoffer, Howie Levinson, Milan from USC. Elaine Muscale we had 1 year, which was brilliant. And the list goes on. There's our current ASRM past president, Moran from Mayo. And we really enjoy having these people. There's 2009, Eddie Rodriguez with Mike Zen, Laurent and myself, who's a dear, dear friend, who his whole success in face transplant is based on anatomy. So with that, I will conclude, Bob, and say thanks for the memories and the opportunity to teach tonight. And I'll be happy to take any questions. Let me turn my lights on. It's nighttime here. I turn my lights on in my study. It's too dark.
Great. Well, thank you so much, Dr. Levin, for this fantastic talk. I had heard an earlier version of this talk at ASRM, and it's even more interesting and fascinating the second time around. So thank you so much for that. And I think all your comments about anatomy, I think, are so spot on, because all of us have had our mentors in anatomy and in teaching. And for example, for myself, one of my mentors in residency was Rod Hentz.
Yeah.
And I've always talked about how Dr. Hentz always talked about surgery is basically only anatomy. And he obviously, as we know, is the consummate anatomist of the hand and obviously the whole body, but especially of the upper extremity. And I think it's thanks to people like you who have really dedicated much of your career to educating younger surgeons in anatomy, particularly as it pertains to flaps, that I think keeps that process going. I think you have obviously personally been involved in training at least over 1,000 people through the flap courses at Duke and Penn, and each of them have obviously gone on to teach many other people within their institutions and their hospitals.
Yeah,
so,
play it forward, right?
Exactly. So, so I want to just kind of comment on that and commend you and thank you for dedicating so much of your time and energy in educating us on the details of anatomy.
Pleasure.
And I think part of the dedication that you had to Clint Lewicki in your talk, I think, was also fantastic. When I was at Duke at the flap course last year, there was a whole section dedicated to him, and Mike Zen delivered the second annual lecture, and it was quite obvious that he has left quite a legacy in not only the Duke flap course, but just in his processes and techniques of preserving some of these cadavers and the latex injections. I want to read a comment that was made by our dear friend Hari Venkatramani at Ganga Hospital, who obviously is one of Raja Sabapathi's partners there.
And my good friend.
Yes, a fantastic guy and a very good friend of mine as well. He comments here that all of your, Dr. Levin's amazing books are in our library, and I still pick one PRS bound edition every week. And it is so nice to see what was done 50 years ago is still so relevant.
Yeah, absolutely. I mean, for the fellows, Harry's absolutely right. You think you're doing something new and, oh, this is so cool and we got to write this up. Just read the French and German literature, or if you can, read Chinese. And you'll find probably a very similar concept, right?
Yeah, exactly. And actually, Chris Peterson, who was on just a couple of days ago, was commenting on that exact thing, that anatomy doesn't change, has never changed. And there's no such thing as aberrant anatomy. They're just basically variations that you need to become familiar with.
Right.
Yeah. But anyway, thank you so much again, Scott. This is a fantastic lecture, and I think it's very inspiring for all of us to continue to learn anatomy and to apply it within our specialties. So I really want to thank you again for taking the time out of your busy schedule to talk to us.
Great to be with you, and I just have such a love for the legacy of Harry that is carried on so beautifully. The fellows just can't appreciate how fortunate you are to be in such an environment, not only with the history, but I know the day-to-day work that goes on there. And now, Babak, you were supposed to have a revasc of a thumb or something. Knowing you got it done in 45 minutes and you made it in time for the lecture, right?
Yeah, full disclosure, it's the end of the year, and actually 2 of my fellows are chomping at the bit to doing the micro. So Dr. Danny Balkin and Matt Kaufman are right now in the OR. So I'm gonna go join
Danny sent me a text saying I won't be there, but wish him good luck. I know all the strategies for the distal part. Look for that arcade.
That's right.
And never give up. That's what we say in micro. See you later.
Thank you so much, Scott. Have a great night.
Okay, Babak, we'll talk. Be well.
Thanks, Scott.
Okay, see you later, Scotty.